At 5:04 this morning, let's get to the latest on the coronavirus in Arizona. Yesterday, DHS reported more than 4,700 new cases. It was the lowest reporting in days, the lowest reporting in more than a month, I should say. Worldwide, we hit 100 million COVID cases yesterday.
Here we are 1 year since the very first case of coronavirus was reported in Arizona, and we're still battling with COVID and have just as many questions as when it all first started. We know you do too.
And that's why we brought in the expert, Dr. LoVecchio with Valleywise Health Medical Center. We appreciate you joining us here on Wednesday as you do every week.
Thank you.
Well, first thing is we're seeing national headlines saying that everyday activities, just like grocery shopping, are more dangerous now because of the new COVID strains that are popping up. And they're suggesting that maybe we revert back to pickup or delivery services. Do you think grocery shopping in the actual store is that risky right now?
The short answer is depends. If you go grocery shopping, you should go in and out as quickly as you can. Some people argue early morning when it's less crowded. They also recommend using hand sanitizer. Personally, I don't recommend wiping things off in the store, but the other question is, who are you? If you have lots of risk factors and older and have not been vaccinated, it's probably a little higher risk than if you're younger, healthier. But again, be stealth, go in and out. If you do order online, some people don't like that either because they don't get their products, etc. I know it's a small trade-off, but personally, I go in, normally it would take me 30 minutes, now it takes me about 4 minutes.
Wow.
4 minutes, speed shopper right there. All right, let's talk about the new strains of COVID, which is what we're getting into here this morning. We're getting a lot of questions about whether the vaccines are going to work as this, COVID continues to mutate. What are your thoughts on that? What do we know about these vaccines and whether or not they will work with the new strains?
Well, so far, the 2 vaccines that are readily available in the U.S. have been tested against it. And what I mean by tested against it is in a test tube or, not in an actual human. And they seem to work, which is a good sign. Of course, you always say, well, is it going to work in humans? And the answer to that is, we'll find out. But all indications are that it's going to work, and, which is very, very promising. We saw the South African virus, the variant, to spread very quickly, which worries a lot of people. But personally, I think that was very promising news that the vaccine is working against it, at least in the test tube, which is the best we have right now.
So Dr. Fauci is making waves for suggesting that we wear not just one mask, but 2 masks at the same time. What do you think about this idea of wearing 2 masks, double masking, and if so, what kind?
I think his point is, more is better until you get to a certain point where you can't breathe. And what I mean by breathe is air sometimes comes in from the sides when you have a mask. And when it comes in from the side, it's probably defeating the purpose. Having a good seal is important. Should we all wear N95s? Probably not. Should we wear maybe cloth masks that have multiple layers in them, and there's special ones that kind of protect things from going through? Not a bad idea. So if you wore something with multiple layers, it'd be the same as wearing 2 masks. Personally, in the hospital, taking care of patients, almost always wear 2 masks because, something like the outside surgical mask really doesn't, block anything except for large particles. And I could also throw that away and protect my N95 or, my other respirator. So in short, probably not for everyone. I think you should wear a relatively good mask. Try to get as close to seal as you can. Multiple layers are a good thing in the mask.
All right, so get a good mask is the most important thing. Sit tight, don't go anywhere. We have plenty of questions for you the remainder of the morning. Dr. LoVecchio here with us on Today in AZ. If you have questions, text them to us, 602-444-1212. We'll get to as many of them as we can. Thanks, doctor.